I'm Dr. David Beaulieu, and I'm back with more news you can use. And I want to talk to you today about something we do in our office and something we do at the Essential Care Centers of America. All of the doctors involved use neuromuscular biofeedback techniques for patient evaluation. A lot of people just call that muscle testing. But it's been a part of the chiropractic profession now since the 70s. And George Goodhart came out with applied kinesiology. Since then, there have been about a dozen different approaches. Dr. Versendahl has a very, very fine approach from Kansas. Les Feinberg out in Portland, Oregon, has come up with NMT, which is another neuromuscular biofeedback technique. Dr. Nambudra Pad out in California has pioneered some MRT. And all of these techniques use a type of muscle testing where you can use any muscle in the body to get information from the body. The reason we do this is that we're learning to communicate with a separate personality. And the personality has been called the subconscious, the unconscious, the inner child. Chiropractic profession has called it the innate intelligence for the last 100+ years. And we're learning that this is the intelligence, this is the operator of the computer. The computer sits between our ears. That's your brain and your nervous system, and it runs the whole show. All we really do is advance reason and advanced will. In Gray's Anatomy, which is the anatomy book that used by every major medical school, chiropractic college, dental school in the country, it states, and I quote, "The nervous system controls and coordinates every organ and structure in the body and relates it to its environment." Controls and coordinates every organ and structure in the body and relates it to its environment. That's everything except advanced reason and advanced will. But the computer doesn't do it all by itself. There has to be a computer operator. There has to be an intelligence past the computer running the computer. And that's the subconscious. And when we began to understand the nature of the subconscious, back in the time of Sigmund Freud, it was understood that until you make the subconscious or the unconscious conscious, you will continue to get what you get, and you will call it fate. When you understand that your unconscious runs the whole show and you don't even realize it's there 90% of the time, when you're lying in bed at night and the thoughts are just popping into your head, you're not thinking them. You're just lying there in bed ready to go to sleep. Who's the thinker of those thoughts? That's your subconscious. And it has an energy and information field that has all of the information about your body stored. And if we can access that information, we can find out exactly what your body needs to help any given health condition. Any given health condition. And the brain, we didn't know this 30 years ago. The brain is a computer. It functions in a binary fashion. It's a yes or no responsive organ. You can use muscle testing to determine whether or not it's a yes or a no answer. The key is asking the right questions. So if you're going to get involved in this, you want to be involved with people who are relatively expert in the area of the questions that they're asking. So you end up with the right answers, because the answers are only as good as the questions that you ask. But this is a whole new way to evaluate problems, where we don't have to rely on diagnoses, which are nothing more than reasonable guesses by an educated person. Now we're going to the patient's very body and saying, what do you need? What's wrong? What's wrong? Oh, that's what you want me to work with? Okay. What do I need to do? What do you need to fix this? And what's the exact dosage? And you get all those answers with neuromuscular biofeedback.